Women don't realize that after their second child, estrogen starts to tank, and they start to feel like they don't want to be touched. And after that last pregnancy, estrogen just doesn't kick back in like it did pre-production. So they start to feel things like, am I ever going to love him again? I feel horrible. What am I going to do with my family? What about my children? And women will misinterpret this repulsion as the truth. Like, this is the truth of their marriage. Oh, I feel this way now. Even though he's a good man, I must have fallen out of love with him. And I think what women don't understand is this whole love, this falling in or out of love, is really estrogen dependent. Welcome to the MeNoPause Moxie podcast, where we strategically challenge the status quo on perimenopause, menopause, and female hormone balancing. I'm clinical hormone coach Marie Hoäg, and I'm here with my producer and co-host Maggie Kuhn. If the thought of sex makes you recoil, if you avoid intimacy, and you're scared of what that might mean to your marriage and your family, listen closely. In advanced female hormone medicine, loss of libido is rarely just stress or just the relationship. It's typically a clinical indicator that estrogen has fallen below what the brain and body requires to give a woman a libido. When that happens, connections tend to fade, and for many women, intimacy flips to aversion. Today, on this Clinical Indicator Series episode, we explain the pattern of low libido, why standard low-dose HRT doesn't fix it, and what changes when estrogen is fully restored. Hey, Maggie.
Hey, Marie. Great to be here today. And so this is a big topic, and we're calling this exactly what it is, a clinical indicator, not a relationship indicator. So let's get specific. What are women actually saying about their sex lives in the clinic? How do they describe what's happening when they meet with you?
Well, I tell you, there's a big uptick right now with a movement of perimenopausal women recognizing that this is a big issue. And they see how it's impacting their marriages right now. And it's stressful. And so when I meet with patients in the clinic or potential patients in consultation, I say, what's happening? They say some incredible things. Over the years, I've heard some crazy stories. Women will say, I don't feel like I love my husband anymore. And it doesn't make sense because he's such a wonderful man. I don't know what happened. They say that they can care less if they ever have sex again. And that being around their husband, that they can feel somewhat repulsed. And that really bothers them. There was one consultation I had where Patty was a 40-year-old mother of two. And her husband was kind of a man-child type guy. So she kind of had three children. And she said that her husband would just bug her for sex in a way that she can tell that he was trying to not make her feel badly about it, but that he just needed her affection. And she says the more that he was trying to get affection from me, the more it just irritated me. And just the way she was talking about it and the way she was expressing herself, and you can just feel her disdain. It was just, I was like, it's interesting. But then woman after woman would come in and say similar things. Some women avoid sex altogether. One woman, when I ask her why she's there, she says, well, I'm here because my husband said that our marriage will end if I don't do something about this. And she was there with her arms crossed. I can tell she did. Well, when she told me she didn't want to be there, and it was clear that she didn't. And she says, I'm here to save my marriage. So just give me whatever you're going to give me, but I'm not going to be happy about this. And what she was saying to me was not unusual, especially how high her FSH was. Now, this woman has been without estrogen for a long time, and she had not had a libido for a long time, I can tell. And the thought of having a libido again and being close to her husband, she just didn't want it. And she said, he's a good man and everything, but I don't want him to touch me. Women come in with just different things. I don't want to have it, but I'm doing it to save my marriage. Or I need to do this to save my marriage. Everything is really about the saving the marriage. Because women in reality, Maggie, it's not necessarily that they want to have a libido and go sleep around with everybody. They want a libido so they can connect again. And that's what these women are talking about. I don't feel connected to my husband. We used to have good sex and connect, and we just don't. I feel numb. I feel dead inside. I used to be a sexual woman, but now it's just, I can't, the thought of it just is like, really, all right, let's just get it done.
So you're alluding to this, Marie, but could you talk further from your clinical expertise about this phenomenon of husband partner repulsion that women start to feel as their hormones drop?
This comes with a lot of shame, especially when women have been in love with their husband and they're finding out that they're not any longer. And it's not as if the husband has done anything, and they know that it's them. And women just don't really understand what's going on. And I think the reason why we see a big uptick with this in perimenopause, one, because we're talking about it, but two, women don't realize that after their second child, estrogen starts to tank. And this actually, the timing around this is they start to feel like they don't want to be touched. And it's like after that last pregnancy, estrogen just doesn't kick back in like it did pre-production. So they start to feel things like, am I ever going to love him again? I feel horrible. What am I going to do with my family? What about my children? And women will misinterpret this repulsion as the truth. Like this is the truth of their marriage. Oh, I feel this way now. Even though he's a good man, I must have fallen out of love with him. And I think what women don't understand is this whole love, this falling in or out of love is really estrogen dependent. And I think once I know that with me, it's like, oh, it's easier for me to love my partner. It's easier for me to express my love to my partner when I feel connected to them when I have estrogen. But I tell you something, and this is easy for women to test. In PMS, women don't have a libido. It's like on purpose. So there tends to be a lot of shame and embarrassment. But now women are actually talking about this with each other. I don't love me either. It's like, what do? We all feel horrible about this. How are we going to do this? But they can't really pinpoint what the problem is, but they all have it and they're going through it. And the husband feels this. They know that they're not desired. And about the same time too, when women are going through their perimenopausal situation, men are going through their own periandropausal situation where their testosterone levels are declining as well. And their libido may be compromised, is most likely compromised. And so there is this elephant in the room of like, okay, nobody wants to have sex. And women are talking about that they're just roommates with their husband. It's like, I like my roommate relationship with my husband. I don't have to, it's like the pressure's off me. It's like, so you just want to live with your husband as a roommate? That's just not very fulfilling. So what ends up happening is just conflict tends to emerge because nobody's happy. This is not what anybody signed up for. And then the libido issues and the sex issues get piled on to other issues like finances and division of labor in the house and those sorts of things. So there's just a lot of shame and not knowing what to do.
Yeah. And I would imagine that, a real risk here is that couples or the woman, make permanent decisions about this relationship while they're in this deficient state, not understanding that the deficient state is what's causing these feelings.
Mm-hmm. And I think, Maggie, you really hit the nail on the head. And if anything, anybody gets out of this, it's this. It's like, this isn't about falling out of love with your partner. Likely, it's more likely due to hormone deficiencies, namely estrogen deficiency.
That is a pretty powerful thing to be understood, Marie.
It changes everything. If we look at it that way, then it changes how we address it. Yeah. But right now, that's just not how things are going, and it's impacting everybody. This isn't just a marriage issue, especially when there's children involved, as you know.
Well, right, because when sex and connection collapse, it impacts the rest of the family. There's a ripple effect.
There really is. Everybody knows what's going on, but nobody knows what it is. The children can see the detachment from their parents. They can see the mother recoiling when the dad wants to touch her and she's skirting around issues. I mean, children see this and it gives them emotional instability because like that There's a lot of studies on this, on how the lack of intimacy between couples impacts their children, because there's this fear that there'll be a separation, that the family is collapsing. I mean, children need this cohesion, and estrogen is the cohesive ingredient for every marriage and family. And without it, everybody will feel the effects of estrogen deficiency. So kids will feel this instability. But not only that, as estrogen is declining, the mother is not only detaching from the father, she's detaching from the children, because not only does she not want to be touched by her husband, there's just this general don't touch me. And so when children even come around seeking love and affection, that the mother's like, okay, just give me a hug and just go on, just does her motherly duty and hugs the child, but the child knows there's just this disconnection. So it does impact the whole family. So it's not about the libido per se. The child will never say, well, my mom needs to have a sex drive so my family can stay together. It's just not about the sex drive. And women tend to internalize all this because they can see it impacting their marriage. They can see it impacting their family. And so they get into this panic state, and it causes this cyclical chaos and disruption in the family that nobody can really identify.
So let's get further into the biology of this. What does low estrogen tell the brain, and why does it change libido and receptivity so extensively and predictably?
So estrogen, Maggie, you've heard me say probably a million times by now, that estrogen is a brain hormone first and foremost. And when a woman's brain is hungry for estrogen, neurotransmitters that govern reward, bonding, and stress regulation malfunction, that can flip intimacy from a pull to a pressure. And so women will feel pressure. Estrogen's responsible for dopamine. When estrogen is deficient, women tend to lose anticipation, motivation, and pleasure. So sex stops feeling rewarding, and it starts feeling more like work or a demand. And serotonin. So serotonin really gives women stability and outlook. So low estrogen increases irritability, anxiety, emotional flatness, malcontent, negativism. So her buffer tends to disappear. She doesn't have the softness and cushion of estrogen. And so her normal relationship friction suddenly feels unbearable, because now she just can't cope with this. And she no longer has the solution. And then norepinephrine, which is the arousal and threat sensitivity. So when this system is dysregulated by estrogen deficiency, her nervous system runs on the edge. A partner's voice, their breath, how they breathe, or their touch can register as overstimulating, almost like a threat signal. And many women describe this. They'll be like, don't touch me. I mean, they will feel it as if there were a stranger that was violating them. And so it doesn't feel comforting like it used to. And this really opens the eyes of women. It's like, I couldn't wait until my husband touched me. I loved it when he touched me from head to toe. And now when he comes at me and I think we might make skin to skin contact, it just makes me cringe. And then oxytocin, this is a big one. Estrogen's responsible for oxytocin. Female sexual behavior is estrogen dependent. Estrogen increases oxytocin binding in the ventromedial nucleus of the hypothalamus, and infusion of oxytocin in this brain area increases female sexual behavior. When estrogen is low, affection can feel like a burden. Also, pheromones play a role. And this was something I found interesting because nobody talked about pheromonal exchange in any of the education or training that we got over these past couple of decades. I mean, I think Dr. William Ragelson wrote a book called Pheromones, and I was fascinated by that book, but he didn't make the connection between estrogen and pheromones because he wasn't necessarily researching hormones as he was about pheromonal exchange, but he did touch on the fact that estrogen is responsible for the signaling. But nobody really talks about it in hormone medicine. But it's something that I've experienced and many women have experienced in the clinic, is this pheromonal exchange, not just the pheromonal exchange between the opposite sex of testosterone, but also a pheromonal signaling that women can omit that allows others to feel safe to approach them. And even young women feel safe to approach women in this situation. So when estrogen is fully restored, a woman's brain, when it's saturated with estrogen, as we've talked about, women report that their pheromonal exchange returns, or they had no idea that the chemistry that they've been thinking or been told years past was just a chemistry thing. Well, it is, but that chemistry, the chemical is estrogen. And this is what nobody is talking about. So when estrogen increases, women say, oh my gosh, I can go somewhere and I can feel the chemistry of another man or another person, or even my husband walks in the room and I look at him, I'm like, oh, and I can feel it in my body. And then when my estrogen is low, because this is when we were doing cyclical hormones and the luteal phase hormones were low, women lost this. Like, why do I have a libido in my follicular phase than I don't in my luteal phase? But now they know it's estrogen is low.
I mean, this, Marie, just explains so much. I can't tell you the number of conversations I've had over the years with, other women, but also in many of these menopause discussion groups. Libido is a top topic, and nobody seems to fully understand what you're talking about right here. So I am just thrilled that this is our clinical indicator of the week here.
Estrogen is really that true driver of a female libido, Maggie. And but as you know, everybody in society is really talking about, oh, well, testosterone is the sex hormone. But it's a secondary hormone. Estrogen is the true driver of the female libido, not testosterone for women. And there is ample data on that. I mean, it's like the National Library is loaded with data, but there's this general consensus that testosterone is a libido hormone for men, so let's give it to women. However, women will get a libido, but it won't be a sexual libido. It will be a recognizable libido, but not a gender type of libido for a woman that creates the sensuality and sexuality that goes along with the female libido.
I mean, haven't you heard women talk about the fact that even just hearing their husband chew drives them bananas? And, and again, all these little things add up, and women think, well, I guess that's it. The marriage is over. I'm not interested. He drives me nuts. I can't stand to be near him. I can't stand to get into bed next to him because of his breathing. I mean, this explains a lot, I think, for a lot of women.
I remember looking at my husband one time saying, do you have to breathe? You have to make so much noise. Why do you make so much noise? You're just getting into bed. How much noise can a guy make getting into bed?
So all of these little things that we wouldn't have noticed before suddenly become super amplified. So what you're saying is when estrogen is low, the brain can misread closeness as a threat, and even pheromonal chemistry can shut down. And when estrogen is restored, women can feel chemistry return. Is that correct? Is it that simple?
Yeah, for the most part. But it depends on the health of the woman too, and the mindset. But estrogen is really truly the pheromonal exchange, the I'm open for business pheromonal exchange type of signaling. This is intentional to the female human species. I mean, when we're in our reproductive prime, we are supposed to be beautiful, pretty, open to sexual activity, sending out pheromonal messages that, we're ripe for fertilization to keep the human species going. I mean, this is intentional during a woman's reproductive prime between, 25, 35, and, probably little later 30s. But when estrogen begins to decline in stage 1 perimenopause around that time, it's like the brain is not really interested in a libido, because now a woman is transitioning out of her reproductive prime and into a place of survival, where now her job is to make sure that her offspring will survive life without her. And so then estrogen continues to decline, libido decline, because it's not her job any longer to reproduce. So this is a natural thing that happens. It's not that there's something wrong with somebody. It's a natural thing. And when I heard this in one of the conferences I went to, there was a biology anthropologist that was talking about this. And he was talking about it in these very terms of how hormones are used to dictate where a woman is in her reproductive lifespan. And how when the messaging to the brain when estrogen is plentiful is that the woman is in her reproductive prime. So the libido is more apt to come back for most women, not all, but for most women. And then the pheromonal exchange. And it's not just about sex. How many patients have said this to me? I'll walk down the store and people that I know would normally ignore me will stop and talk to me. People are actually looking at me in the eyes when I'm out in the community instead of avoiding me or walking around me. And it's weird because society feels this type of pheromonal lifeness that women can put out. It's not just a sex exchange. It is that I am alive and I'm here and strong exchange, really.
Charisma is what we used to call it.
Yeah, that's estrogen. Estrogen is the charisma agent. It is the charisma hormone for women. It is a sensuality, sexuality hormone that allows a woman to feel like a girl.
So based on your clinical work with thousands of women, there are other influencers that impact a woman's libido. What are some of those?
You bet. It's not just about estrogen. I talk a lot about estrogen because of its just its impact, but there are other factors that influence a woman's libido. There are also other side effects of estrogen deficiency that contribute to a low libido. So estrogen deficiency, a woman is guaranteed to have depression, anxiety when she's estrogen deficient. It is very difficult to have an intimate relationship with somebody when you just feel like you want to die. I mean, it's just horrible. So estrogen impacts not only directly a woman's libido, but indirectly on all the other side effects that estrogen deficiency brings. Another thing is diet. Women don't understand that what they're eating will suppress their libido. It will suppress their estrogen. It'll suppress their desire. It'll suppress their response. Phytoestrogens, people think are estrogens, but they are not. They will lower estrogen levels, which is why we don't recommend patients eating phytoestrogens. Processed foods will shut estrogen production down and lower a woman's libido. Undereating, overeating, sugar will reduce estrogen to the point where a woman will not want to have sex. In fact, she'll feel so bloated and miserable. That's a whole nother way. So some women actually on purpose will eat themselves out of, oh, I just feel too miserable to have sex. I mean, they'll find themselves doing things to avoid the situation. When women exercise too much or too little, too much exercise will just strip the body of estrogen. Too little exercise, a woman isn't circulating her estrogen enough around her body to benefit from that. Lifestyle, sleep. When a woman sleeps, circadian rhythm regulation is extremely important when restoring estrogen. Sleeping when the sun is down, being alive when the sun is up. This circadian rhythm does impact estrogen levels and vice versa. Medications, SSRIs, antibiotics, these types of things will just drop a woman's libido. And some women go on antibiotics for a long time, whatever their situation is, and they seem like they're always on them. Surgeries, infections, viruses, those things will suppress estrogen production and libido. Trauma history, PTSD, childhood trauma, childhood sexual abuse, that will impact a woman's libido, but also estrogen helps those things too. Low testosterone. Women do have low testosterone. They produce testosterone. Testosterone is a libido hormone for women, but it is a secondary libido hormone for women. And it's something we address secondary to estrogen and progesterone replacement. And so the goal is to build the female foundation with her gendered hormones, which are estrogen and progesterone, and then incorporate the tertiary hormone like testosterone to pull in the libido. And some women, there are other hormone peptides that actually help enhance the libido. So there are plenty of hormones, hormone peptides, and medications to help a woman's libido as well. Now, the thing is environment. If a woman is working in a high stress environment, or she's walking on eggshells at home or at work, she won't want to be intimate. She won't want to be close to anybody. She's going to want to be alone and either drink herself to death or eat. And this is also a side effect of estrogen deficiency. And so women will get irritable and they'll get upset that there's a division, an off balance of a division of labor in the household. And then like all these little resentments tend to build up over time. And then there's just this, just this disdain. And the worst part about this is it's felt in the household. And the mother is the nucleus of the household. And when women don't have enough estrogen, it destroys families. Financial stress, Maggie. People are under so much stress, their stress load. If a person is under a lot of stress in general, or they're under some sort of financial stress, that'll kill a woman's libido. And also religious beliefs. So yeah, there are other things that can kill a libido. How a woman views sex can kill a libido. So if women think how they grew up with it, the mother's viewpoint on sex that was handed down to the daughter, that sex isn't good and should only be for reproductive purposes. So yeah, it's not just about estrogen. There are many other factors, but even if all of these other factors weren't present and you didn't have estrogen, the libido wouldn't be there. Estrogen is the core hormone for every woman, for every process, for every function. Every biochemical action is dependent upon estrogen, and that is including the libido.
Well, I would think one big clue for most women would be if you used to have a libido and it's suddenly gone in your after childbirth or later 30s, 40s, and beyond. That's a big clue.
Very much.
So, could you give women, Marie, a clinical checklist? How do they know this is a hormone driven issue and not just relationship problems?
Don't guess. One woman will feel it inside. They know something's going on with them. And they're right. Yeah, something is going on with you, but it's not a bad thing per se, or a personality trait or a character flaw.
Or that you've fallen out of love with your partner.
Yeah. No, there is something going on. Pay attention to it. Do blood labs. Understand estrogen. It's so important for women to understand estrogen and what it does for a woman's brain and body, and how much they need to function and thrive. Not only just as she's aging, but just how her brain and body are falling apart.
What are some of the other things on this checklist that would tip women off?
So blood labs, finding a doctor who knows what they're doing, who knows what blood labs to take, is really important. So when you feel something's going on, get your blood drawn, know where your estrogen needs to be. If you feel like you're emotional and you're volatile and you know it's not your husband because he didn't do anything, that's not a relationship issue. It's an estrogen issue. A low libido is a clinical indicator of estrogen deficiency, bottom line. And so that's the first thing you should look at. And that there are 50 clinical indicators of hormone deficiency, not just low libido. So we monitor these clinical indicators in the hormone clinic and measure them with blood labs. So if you want to learn what the other clinical indicators are and where you are with your libido clinical indicator, go to advancedhormonebalancing.com and take the hormone balance test. This is the best way for women. So if you take the hormone balance test and you look, oh my gosh, my score is outrageous. And then find out what options you have. And me, Maggie, it's like you need some good hormones first and foremost.
Well, yeah, I mean, that's really obviously the point of this podcast is to help women understand that all of these things, every episode that we talk about, the various issues, all are attributed to all kinds of other things. And in this particular one, in terms of libido, it's often the loss of libido is often attributed to, well, that's just life. What do you expect? You thought you were going to be in love forever. That's a myth. You thought you were going to be attracted to your husband forever. That's a myth, but we've all bought into it. So what we're really trying to do here is dispel the myths and help women understand that, most of the time, get your hormones checked, and it's likely there that you will find the clues and the solution.
Yes, but you also know there's a caveat to that. Or you can get your hormones checked, but where you go to get those checked is super critical.
Right. So let's talk about that. How does conventional medicine typically handle a woman who comes in saying her libido is gone or that sex feels repulsive?
Yeah, as you mentioned, Maggie, women are just told that this is a part of life. And every woman goes through it. Get a hobby, buy lingerie. Those are the things that were told to me. Get a hobby, go buy some lingerie. It's just aging, practice self care. They're prescribed psychotropic drugs to manage the symptoms. They're told to get lubricants and sex toys and try to spice up the bedroom. And they're also recommended counseling, therapy, cognitive behavioral therapy, which is good and it has its place, certainly. But if a woman doesn't have estrogen, she can talk until she's blue in the face about how horrible it is to not have a libido and to not be connected to her husband. But without estrogen, it's just not going to happen. They're prescribed low dose hormone therapy. So if they do find a doctor they go to, unfortunately, the doctor says, oh, let's give you hormones, but there's no real clinical destination they're shooting for. There ends up being a ceiling of dosing. And then women will go back to, they may get a libido back when they first start low dose HRT, but then it diminishes because it's just not enough. It's just minuscule dosing is what patch therapy is. And it's not designed to be sustainable. And so women, even if they do go to the conventional doctor, they're given low dose therapy. They feel good. Oh yeah, I feel good. They may not have the libido that we're talking about because the doses are still so low. So this is why women need to understand, how much estrogen do I need, and who is trained to prescribe therapeutic dosing so I can get what I need, not just now at this time of my life, but till I die. I want to feel good to the day I die. I don't want to feel good for the next 10 years and then drop off. And what's nice is estrogen is the agent for women to do that if she's dosed correctly. So the typical medical lens is basically symptom and then label driven. So there's a lot of labeling, because if you can label this in women, then the pharmaceutical industry can manufacture drugs and get money for these drugs under these labels. So if you create a diagnostic label for a patient, well, guess what? The pharmaceutical industry, now we can manufacture drugs for just this group of people who doesn't want their wives to have a sex drive. Really? Let's just manufacture these drugs. And so now there's this mindset, oh, we hear you, ladies, take these drugs for these conditions.
Speaking of labels from conventional medicine, what are some of those labels that women with low libido are given?
Well, medical terms for female sexual issues are generally classified as female sexual dysfunction, FSD. They like to give these things their labels and names so they can attach a diagnostic code to it. So some of those diagnostic labels are the female sexual interest arousal disorder. And that's a combined diagnosis of low desire, low arousal. So even if you had low desire, somebody touched you, you'd be like, meh, you're not really aroused. And that's very common in estrogen deficient women. It's like, yeah, you can touch me, but I'm not going to let you know it.
But I'm not going to like it.
Yeah, just do what you need to do. I'm going to balance my checkbook in my head and then we'll be done. And then I'll have a good, and then there's hypoactive sexual desire disorder, which is consistently absent sexual desire, which to me, there's some overlap of these things. But again, if you have a diagnostic code, then there's a lot of money that goes into manufacturing drugs to manage the side effects of estrogen deficiency, such as SHDD. Female sexual arousal disorder, which is FSAD, which is difficulty achieving and maintaining physical arousal or lubrication. Estrogen is such a great agent for this if it's dosed correctly. But they're not going to this. They're not saying, oh, well, these are all the side effects of estrogen deficiency. Why are we just giving women these drugs and managing the symptoms? If we just give them the amount of estrogen they need, these conditions wouldn't exist. This is just like with mental illness diagnoses. This is like with just about everything else that women are exposed to, no matter which doctor they go to. Oh, you have this condition, you have this disease, this disorder. But you know what, Maggie? Every single one of these things will point back to estrogen and the lack of estrogen, every single one of them. Some others, another one is female orgasmic disorder. Women without estrogen will have a very difficult time achieving orgasm. I mean, the
I've
sexual
heard that
stimulation.
so often from women who say, I used to have, multiple orgasms. I used to be so orgasmic and now I can't have one. They're sad. They feel sad, you know, but they're given that label
Yeah.
instead of, again, knowing that there's a different approach that could actually
And with
impact the
me,
whole
I never had
system.
one. Yeah, I never had an orgasm. I didn't even know what in the heck that was. And then when I got on a therapeutic dose protocol, it was crazy how things were changing. And I had a pheromonal exchange. And then women, like I mentioned before, what's nice in the clinic when women were going through these things and they would come back and check in and tell me how they were doing, I was going through this too silently, saying, oh my gosh, this is like crazy. It's not just me. So there was a lot of validation for me when I was going through this. So when I had my orgasm for the first time, I'm like, this is just crazy. So this is what everybody's talking about. I mean, this actually just changed the way I viewed sex and orgasm. I'm like, I need to know more about this. One thing that's really concerning me, Maggie, that's coming up is this a new diagnosis that's come up. And all these this concerns me when we hear these new diagnoses that come up that are directly related to estrogen deficiency. Well, the female orgasmic disorder, you give a woman estrogen and then test her orgasm. Why they're not doing that is beyond me. We should have plenty of data on that because it's so easy. The dyspareunia, the genital pain with sexual intercourse. Without estrogen, that vagina is as dry as the desert. Trying to have sex dry is just a miserable, painful experience. So if you don't have any sort of arousal, there's no lubrication, there's no arousal from the touch or anything. And so there's just this experience of going through it. And that's painful. That is painful. So the one condition I was telling you that's really big that all the doctors are talking about, and you'll see this, is a term called GSM, the genital urinary syndrome of menopause. Basically, your pelvic floor. I mean, the prolapse uterus, the vagina, all the problems that are going down south. Now they've given it this global name, and now there's a lot of medications that are coming out. This will help with your vaginal lubrication. This will help with this, and this will help with this, and this will help with this to varying degrees, but it's not sustainable. So now patients on about a half a dozen to a dozen medications to manage the symptoms of estrogen deficiency they otherwise wouldn't have if you just gave a woman enough estrogen. So my concern is women, they feel like there's this false sense of being heard. Oh, you understand that it's painful to have sex. You understand how dry I am. You understand. Okay, I'll take your medications because I feel you understand me. But they don't really understand you.
Women are desperate. They're desperate for solutions, understandably. So, there's probably some relief in hearing, oh, I've got this condition and there's a medication for it. But
now, Maggie, it's to be known that these conditions, especially the ones that I've read off here, the common thread of all of these are estrogen deficiency.
yeah.
So before if your doctor's going to shell out these terms, these diagnoses to you, address the root cause.
Yeah, well, that's definitely the bottom line and the common denominator. So, okay, sometimes women are on HRT and they still feel dead inside and still don't want sex. So, what does that mean clinically? What's going on there?
They're underdosed or they're on the wrong HRT system. I mean, why there are no studies on this in the National Library of Medicine is beyond me, or there's very few studies. You give a woman estrogen, she has a libido. You take it away, she won't. I mean, it's a fact of life. And well, some women won't get a libido back because there's other things, as you know, but estrogen is the libido driver. So women are placed on these low dose, short lived protocols. They don't last very long. So most women, when they start an HRT system, if they've never had hormones before, they'll feel good initially. But as I've mentioned many times, they're short lived because they're underdosed. A woman can be on the right protocol, but it's misdosed. A lot of symptom masking approaches like products, treatments, procedures to mask the symptoms of a woman's libido. This is what women are getting when they're going to the doctors. So they're getting inconsistent delivery systems. They're just throwing things at the wall to see if it'll stick. There's no real consensus on what does it mean to restore a libido in a woman and what does it take? How long does it take? What does that look like? Women are just jumping from doctor to doctor looking for a doctor who's going to who give them, not lead with testosterone. A good way to know that you're going to the wrong libido doctor is when they lead with testosterone. This should tell any woman that this doctor is not educated in estrogen, because they are clueless that the libido starts with estrogen in women. The libido starts with estrogen. Secondary is testosterone. So women, they get confused. They're like, I'm going to the doctor, I'm taking hormones. Where's my libido? So women are told, well, this is just aging. But in all, Maggie, they're estrogen starved.
All right. So now the important part. What should women actually do to restore libido, Marie? Can you explain this clinically?
Well, one, how it's addressed is really important, because that's going to determine who a woman goes to for care. So understanding how estrogen affects the libido, but also the body from head to toe. So understand that first. We're going to address the root cause. That means you need some estrogen. Then you need to get on a good HRT system that delivers a therapeutic dose that gets you into the optimal levels. So if you're not on an third or fourth generation HRT system designed for full restoration, patients aren't going to have a long-term effect. And if you do get on an advanced HRT system, it needs to be supported. You can't just take, especially an advanced HRT protocol, without giving it support. And what I mean by that is estrogen needs a good farm to table diet. It needs plenty of animal meats. It needs plenty of animal fats. It needs plenty of raw dairy, raw eggs, raw milk, raw cheese, ancestral type of eating when the foods our ancestors ate, traditional types of diets, 1 and 2 ingredient foods. This is the best type of food to nourish the body so that the hormones can work the way that they're supposed to. Also, physical activity. Women will say this. It's interesting. They'll say, well, you always tell me that estrogen needs to be circulated. Estrogen needs to be circulated. You can't just take a therapeutic dose protocol and sit around all day. It needs to be circulated through exercise. The body needs to be flooded with this estrogen and be dispersed from head to toe. All of your organs need this estrogen. So when women exercise, they're able to disperse this. Taking estrogen without exercise, it's just a different experience. You can do it. You just won't have as good of an effect. You don't have to eat a farm to table ancestral diet, but you'll have a better effect than if you ate a vegan diet. Sleeping when the sun is down. People who work graveyard shifts don't have as good of experience than people who sleep when the sun is down. And I won't get into this, but there's some great information on this. And maintaining this estrogen tank for life. There's no reason to ever get off of estrogen. So my recommendation is really to increase your libido is fill up that estrogen tank and just keep it full. And to tell a woman with a low libido this next thing, Maggie, she's not too happy about, but one of the best ways to boost a libido in women is to have sex.
Use it or lose it.
I know. The more sex you have, the more sex you want. This wakes up the female brain and body, and also the testosterone exchange through saliva. That is also another way that can boost a woman's libido when they're kissing and through oral sex and that sort of thing. That was interesting studies to find. So yeah, they're very specific for women. Understand that this is most likely an estrogen deficiency issue. Get on a therapeutic dose HRT system designed for full restoration. Eat a healthy farm to table diet. Get good sleep. Move every day. Meditate to clear your head and to connect your inner body and your outer body, and maintain this for life.
Pretty straightforward.
And have sex.
Yes, and have sex.
That's on the list.
Husbands everywhere will be singing the praises of Marie Hoäg.
She said have sex.
So, Marie, when estrogen is adequately restored, what improves first? What do you see clinically?
Mood. There's a sense of calm, clarity, peace, contentment. And for some women, it's unrecognizable. It's like, what is this? And when women's brains calm down, women's brains need estrogen. A woman's body will just fizzle out without estrogen. And so when the brain is getting some, it's just like, oh, and women will feel it. But then when she sucks up that estrogen, like with low dose therapy, she's like, what happened? I was feeling good. Why don't I feel this way any longer? So this is why it's like, this is how you know if you're on a good HRT protocol. If you felt good and your mood was, you felt good when you first started taking it and it stopped working, then you're underdosed. I mean, it's pretty standard actually. Well, not standard in conventional medicine, but it's one of the clinical indicators of estrogen deficiency. And there are 50 of them. So this is what women need to pay attention to, these 50 clinical indicators. And so, and Maggie, if women have a low libido, let me tell you, nobody ever comes into the clinic with just a low libido. There are many other things going on. They're having hot flashes. They're not sleeping. They have low energy. They're just not wanting to engage. I mean, you know the list. And that's why we monitor them all, because it's not just one thing. And women they'll start sleeping again. They wake up in the morning feeling rested, and that's new for them. And that gives them this organic energy to get through their day. So guess what? They're not avoiding sex because they're exhausted. They actually have energy for sex, which is nice. That's on top. That's like an extra bonus. Oh, I have energy. Not, all right, I love you. Let's do it. It's like, hey, let's do it. Because it's just, that's how the brain now has the juice it needs to be in the game. And so, this settles in, this libido kind of settles in, and it now becomes a part of a woman's life and her lifestyle. It's no longer a black and white thing. Now it's something that the marriage it's a different type of a balancing in a marriage, especially if the husband is restoring his testosterone. Very different. Really, there has to be, you can't have one person in a relationship be hormonally deficient and think that you're going to have a good sex.
So this episode has been about libido. And what we've really, I think, heard in this episode is that low libido in women is explainable, it's predictable, and there's a path forward. So, Marie, if a woman is listening right now and she's scared that this is now just who she is, the low libido, not wanting a physical relationship with her husband or partner, what do you want her to know before we close?
Here's my bottom line, Maggie. The loss of libido, especially when it flips into aversion, is often a clinical indicator of estrogen deficiency, not a marriage diagnosis. So if you're a woman who feels like you have fallen out of love with your husband, just go to advancedhormonebalancing.com and book a consultation. Let's have a conversation, because your marriage isn't doomed and it's not over. So if you're living this, you deserve love and connection again. And you just need a good hormone restoration plan that brings your brain and body back to life. That's really what I want the message, Maggie. So hopefully this episode resonated with you and it gave you some marriage hope, because that's a big deal, and family hope. So I want to thank you for joining us today. And remember, everybody benefits when your hormones are balanced. I'm Marie Hoäg, and this is the MeNoPause Moxie podcast.